Nurse Jock here. I'm tuning in today to help you and your families prepare for the COVID-19 season and new school year. Stay tuned. Disclaimer. This video in no way, shape, or form was made to force practices upon you. Please use your own beliefs and practices in your best interest. No violence will be condoned on this channel or on this video. Thank you. Here I will be providing helpful information and tips to help you better prepare your own COVID-19 kits at home. Some products that may be useful are hand sanitizer and travel bottles, antibacterial wipes and disinfectant sprays, alcohol and applicators such as Q-tips, cotton swabs, and cotton pads, Kleenex and lip balm, hand lotion of your choice, masks, preferably creative for girls and boys and adults, thermometers of your choice, antiseptic or mouthwash of your choice, saline nasal spray, cold and flu products, preferably multivitamins that include vitamins of C, D, B, and zinc. Of size of your choice, small ones, big ones, and even a Sharpie so you can write on labels. So you might ask me, Nurse Jock, why are all these items important? Let me tell you. In accordance to the CDC, sanitizers can quickly reduce the number of germs on hands in many situations. However, we must remember that sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy. Hand sanitizers might not remove harmful chemicals from hands like pesticides and heavy metals. And we must caution, swallowing alcohol-based hand sanitizers can cause alcohol poisoning if more than a couple of mouthfuls are swallowed. Keep it out of reach of young children and supervise their use. To prevent the spread of germs during the COVID-19 pandemic, you should also wash your hands with soap and water for at least 20 seconds or use a hand sanitizer with at least 60% alcohol to clean hands before and after. Touching your eyes, nose, or mouth, touching your mask, entering and leaving a public place, touching an item or surface that may be frequently touched by other people, such as door handles, tables, gas pumps, shopping carts, or electronic cashier register or screens. Remember, following 5 steps to wash your hands the right way. Washing your hands is easy and is one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout the entire community, from your home and workplace to child care facilities and hospitals. Follow these 5 steps every time. Wash your hands. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you need a timer, hum the happy birthday song from beginning to end twice. Rinse your hands well under clean running water. Then dry your hands with a clean towel or air dry them. All of this helpful information on hand washing can be found on the CDC website. Next item, nasal saline irrigation. In reference to the NIH U.S. National Library of Medicine, nasal saline irrigations are a safe and commonly used mechanism to treat a variety of sinonasal diseases, including sinusitis, rhinitis, and upper respiratory tract infections, when used properly. These irrigations are a safe and easy intervention available over the counter without a prescription. Additionally, baby shampoo has been found to be a safe additive functioning as a surfactant when a small amount is added to the saline rinses, which may help augment clearance of the sinonasal cavity. While many systemic medications and treatments have been proposed for COVID-19, there are not yet been a study looking at targeted local intervention to the nasal cavity and nasal pharynx, where the viral load is the highest. Studies have shown that the use of simple over-the-counter nasal saline irrigations can decrease viral shedding in the setting of viral URIs or upper respiratory infections, including the common coronavirus. Further, as SARS-CoV-2 is an envelope virus, mild detergent application with nasal saline would neutralize the virus further. It is our hypothesis that nasal saline or nasal saline with baby shampoo irrigations may decrease viral shedding, viral load, and viral transmission, secondary to bacterial load, nasopharyngeal inflammation in patients infecting with the novel SARS-CoV-2. This information can be found on the clinicaltrials.gov website. Next item, face shield. Face shields fall under the other types of face protection. In reference to the CDC does not recommend using face shields or goggles as a substitute for masks. Goggles or other eye protection may be used in addition to a mask. Do not put a plastic face shield or a mask on newborns or infants. Face shields and goggles are primarily used to protect the eyes of the person wearing it. Goggles do not cover the nose and mouth. Face shields are not as effective at protecting you or the people around you from respiratory droplets. Face shields have large gaps below and alongside the face where your respiratory droplets may escape and reach others around you and will not protect you from respiratory droplets from others. However, wearing a mask may not be feasible in every situation for some people. Face shields and goggles. For example, people who interact with those who are deaf or hearing impaired may find that a face shield is better than a mask when communicating. If you must wear a face shield instead of a mask, remember, choose a face shield that wraps around the sides of your face and extends below your chin, or a hooded face shield. This is based on the limited available data that suggests these types of face shields are better at preventing spray of respiratory droplets. Wash your hands after removing the face shield. Avoid touching your eyes, nose, and mouth when removing it. Clean and disinfect reusable face shields according to the manufacturer's instructions or by following CDC shield cleaning instructions. If you use a disposable face shield, wear it once and throw it away according to the manufacturer's instructions. All this helpful information can be found on the CDC website. Mask. What you need to know about masks. When you wear a mask, you protect others as well as yourself. Masks work best when everyone wears one. A mask is not a substitute for social distancing. Masks should still be worn in addition to staying at least 6 feet apart, especially when indoors around people who don't live in your household. Masks should be completely covering the nose and mouth and fit snugly against the sides of the face without gaps. Masks should be worn anytime you are traveling on a plane, bus, train, or other form of public transportation, traveling into, within, or out of the United States and in U.S. transportation hubs such as airports and stations. Hey, this might be important for school. Your children are getting on the bus soon. People aged 2 and older should wear masks in public settings and when around people who don't live in their household. Wear a mask inside your home if someone you live with is sick with symptoms of COVID-19 or has tested positive for COVID-19. Wash your hands with soap and water for at least 20 seconds or use hand sanitizer with at least 60% alcohol after touching or removing your mask. Masks may not be necessary when you are outside by yourself, away from others, or with people who live in your household. However, some areas may have mask mandates while out in public, so please check the rules in your local area, such as in your city, county, or state. Additionally, check whether any federal mask mandates apply to where you will be going. CDC continues to study the effectiveness of different types of masks and update their recommendations as new scientific evidence becomes available. The CDC recently conducted a study in a laboratory that tested the performance of different mask combinations. There are several easy methods to improve the performance of your mask. All of this information and more on masks can be found on the CDC website. Next item is vitamins. In reference to Harvard Healthcare, some vitamins that may be helpful in treating COVID are vitamins B, C, and D, and zinc. What vitamins can help in the fight against COVID-19? Because COVID-19 comes with cold and flu-like symptoms, vitamin B, C, and D, and zinc may be helpful in boosting your immune system and fighting the illness in the same way they can help you get over the cold and flu. Vitamin C. Generally, vitamin C can help you fight a cold faster or ease your cold symptoms if you are taking it prior to getting sick. As an antioxidant, vitamin C can help reduce inflammation, and lung inflammation is a severe symptom of COVID-19, which can lead to respiratory distress or even death. So if you're still healthy, it doesn't hurt to start taking vitamin C now. Food sources include broccoli, Brussels sprouts, spinach, cantaloupe, oranges, grapefruit, and strawberries. Vitamin D. The primary function of vitamin D is to help your body maintain optimal blood levels of calcium and phosphorus, which you can get through exposure to the sun's ultraviolet rays or through supplements in the foods you eat. Getting enough vitamin D can also protect you from respiratory infections. Vitamin D supplementation is stated to significantly decrease the chance of respiratory tract infections based on clinical studies published in the Journal of Pharmacology and Pharmacotherapeutics. Food sources include salmon, tuna, sardines, fortified cereals, juices, milk, cheese, and egg yolks. B-complex vitamins. Vitamin B6 is essential to keeping your immune system in top condition. Be sure to get enough vitamin B as part of your daily diet or in a multivitamin. Food sources: kidney beans, poultry, meat, milk, eggs, fortified cereals, bread, sunflower seeds. Zinc. Popping a zinc throat lozenge or taking an over-the-counter cold remedy with zinc in it as a syrup or tablet may shorten the length of rhinovirus colds. Zinc also helps symptoms nasal congestion, nasal drainage, sore throat, and cough resolve sooner. Zinc has also been found to help produce an active T-cell, T lymphocytes, which trigger the body to respond to infections according to the National Institute of Health. Food sources: meat, shellfish, legumes, dairy, seed, nuts, eggs, whole grains. More of this information can be found on the healthnewshub.org website. Hello, Nurse Jock again. Now that I have covered some of the items that will be included in the COVID prevention kits, I think it's important to say that all of the information that I covered in this video can be found on the CDC website or other accredited sources that was cited throughout the video. Please stay tuned. Now let's prepare these kits. Yeah! about making these kits. They come in all shapes and sizes. You can have large ones for your home, for all your family. You can have medium-sized ones to put in your car, and you can have small ones so your kids can take to school with them. All of these kits can come in handy in preventing COVID-19. Also, I would like to thank all of my viewers. Your effort can make a difference and can save a life. As I always say, if you have touched one person, you have done enough. And please remember to vaccinate, vaccinate, vaccinate. This message, you can get this out to the community, and you can help even on a larger scale by advocating for those in underdeserving communities who cannot get out there, who don't have a computer, who don't have access to care. Your voice can be used as an advocate for these people. Please join the fight in preventing COVID-19. Thank you.